welcome back. If you're new here, I'm Dr. Grace, family doctor and clinical psychologist, and this is Weekly Minute. This week, we're talking about STIs, sexually transmitted infections. STIs are infections that are transmitted from person to person via contact during sex. They can also be transmitted skin to skin and also during pregnancy or childbirth. So like with any other infection, it's important to recognize the symptoms. The main thing and the most troubling thing about STIs is that you can have an STI with no symptoms. However, the most common and the most important to note are: number 1, painful or burning urination; 2, unusual discharge; 3, any sores or blisters or bumps in the pubic area can be an indication of an STI. Another symptom can be irritation or itchiness. Some get lower belly pain or swollen glands or fever or just not feeling well. Also, testicular swelling or pain or any new rash can be an indication of an STI. Remember, no symptoms does not mean no sexually transmitted illness. The most common STIs can be divided into what causes them, either bacteria, virus, or a parasite. In the bacteria category, we have chlamydia. Chlamydia is caused by a bacteria, and it's the most common because it's the most commonly without symptoms. However, if there are symptoms, you'll get unusual discharge like we talked about, or pain. The most important thing to note is chlamydia that is not treated can actually lead to serious complications such as infertility or pelvic inflammatory disease. The second bacterial infection is gonorrhea. Gonorrhea is caused by a bacteria, and it does have symptoms most of the time which are similar to chlamydia with the discharge or the pain, and if left untreated can cause fertility complications. The third bacterial infection is syphilis. This one is different from the other bacteria infections because it starts with 1 painless blister or sore in the pubic area. This then later can completely disappear or lead to a rash. Unfortunately, if it goes untreated, can lead to serious complications including neurosyphilis, which is where the syphilis affects the brain or even other parts of the body. Good thing about the bacterial infections is that there are antibiotics for all of them and therefore can be completely treated. Now with the viral sexually transmitted infections, the most known is HIV. HIV infects the immune system and therefore every organ in the body is affected. Another viral infection is HPV. The most common symptom of HPV is warts. The good thing is we have a vaccine for HPV that can prevent HPV complications. One of the main and the most noteworthy complication is cancer. The third viral infection is herpes. Herpes is caused by HSV, another virus. One of the symptoms can be warts, can be blisters, can be sores, and these are usually painful. The last common infection that we get is from a parasite called trichomoniasis. Trich, for short, is a parasite that will lead to unusual discharge, pain, like we talked about. The good thing about trich is there is medication that can treat it and treat it completely. Remember, with all of these infections, you can have one of them without any symptoms. So what can we do to protect ourselves? The number 1 way is choosing not to have sex. Number 2, using condoms correctly each time if you decide to have sex. Number 3, like we talked about, getting vaccinated for HPV. Number 4, don't share needles. And number 5, get tested so that you can get treated. So, get medical help if you have any of those symptoms. STIs are infections, and most of them are treatable. So, get tested, get treated, and protect your future. If you or anybody you know has any questions about STIs or want to get tested, come in and we'll be glad to help. I'll see you next week.